I'm Dr. Debbie Lathrop. I'm a mental health therapist specializing in the needs of the gifted and creative. I came to this position as a result of my own experience as a gifted person and as the mother of 5 gifted children. For all of us, it was a struggle to fit in and to feel appreciated. So it became my mission to do something to help others who were having similar struggles. As a child, I was frequently told to stop being so overdramatic when I was upset. I wasn't aware of trying to be overdramatic, nor was I trying to solicit any specific kind of response. I just wanted someone to hear what I was going through and validate my feelings, and maybe give me some support. When I started to recognize the same behaviors in my children, I knew I needed to know more about this overdramatic phenomenon. Nothing is more frustrating than to have significant feelings and not have anyone understand what you are going through. You feel alone and different, an outsider. Feeling alone and different is part and parcel of being gifted and creative. In school, you were often the subject of bullying. In the workplace, you were often the topic of office gossip and see people snickering about you behind your back. These kinds of targeting behaviors and the resulting loneliness lead to significant depression. Kids in school can try to blend in by changing themselves to fit into the norm, which leads to further depression. Underachievement can also be the result when a student tries to hide his or her true potential to fit in, or underachievement can happen when a student is not fully engaged or bored by the curricula. Underachievement can happen with adults, too. It's a little easier to hide your accomplishments at work, but not always. Being a leader of the pack when you surpass the boss is not well received. Gifted and creative people typically struggle in the workplace, unless their bosses are their intellectual equal and the work they are engaged in is appropriate fit for them. I can help with all these problems. I don't try to change the gifted and creative to help them fit in. Rather, I help them appreciate their differences and figure out where they belong. I make sure they don't feel so alone, and that can do wonders with depression, even without medication. I have the experience of having worked through my own issues and my children's issues. I bring that experience to bear with all my clients. I also have 5 years of clinical experience that makes me conversant with issues outside my own experience. I have the compassion and personal understanding that enable me to relate and connect with my clients in a very authentic way. I hope you will choose to see me. I would be delighted to participate with you in a brief phone conversation where you can decide if we would work well together. I'm confident that I can help. Please contact me by phone or by email. I look forward to hearing from you.